Between 1/3 and 2/3 of children diagnosed with autism display some form of problem behavior at some point in their lives. The most common forms we see include self-injurious behavior, which is problem behavior directed at oneself, aggressive behavior, property destruction, and sometimes behavior such as pica, which is the ingestion of inedible objects and items, which can be very dangerous. The more common forms of self-injury we see include head banging, banging one's head on hard surfaces or on one's own body, hitting oneself in the head, self-biting, self-pinching, that sort of thing. These behaviors can be very serious and produce significant injury to oneself. Problem behavior is more common and more severe in individuals with more significant deficits. So the greater the communication deficits, the greater the social deficits, and other deficits in terms of intellectual functioning and leisure skills, the more likely an individual is going to display problem behavior. But generally, for us to be concerned about these behaviors, we do need to see them happen multiple times. Typically, the rule of thumb is if behaviors persist for a month, or if the behaviors are producing serious injury, even a single occurrence can be a problem. You could sort of categorize behavior in terms of mild versus severe based on several dimensions. One could be how often the behavior occurs, and the other could be how risky or how problematic the behavior is in terms of how much it disrupts the individual's functioning and to what extent it causes injury to oneself or others. Sometimes the more mild forms of problem behavior may come and go, and it may be depending on what's going on in the environment in the child's life. In other cases, the problem behavior may be addressed only through intensive treatment. And in some cases, the individual may need multiple courses of treatment. The current thinking is that it's a combination of biological variables, certain predispositions, and the interaction between those variables and events going on in the environment. So a child may be predisposed to have problem behavior, but the way the environment that he's in terms of the level of stimulation and how people react to that behavior might increase the probability of that behavior being strengthened over time and eventually becoming a significant problem. No predictable way that we can identify, and I've seen a range of things where some parents report problem behavior just started occurring very quickly over a very short span of time. In other cases, parents report a slow sort of onset. So with all children, particularly children that are nonverbal, it's important to rule out any medical conditions that may be exacerbating or causing problem behavior. And that starts with meeting with the child's pediatrician and doing whatever is needed to try to rule out medical causes. GI or gastrointestinal problems are more common among children with autism. We have seen some kids that have worsening behavior when those conditions are exacerbated, and ear infections are commonly reported as a problem that sometimes leads to self-injury or other just general agitation that sometimes leads to problem behavior.